Hello, everyone. Welcome to Nursing 4021 Community Health. I am your instructor, Melinda Bogardus. I am making this video to introduce myself to you all. You can call me either Dr. Bogardus or Professor Bogardus, and I am really looking forward to getting to know you all and to hearing your introductions. So here goes mine. So in terms of a nurse who has been inspiring to me, I'm really looking back at history, and it's hard to pick out just one nurse. So I've selected two nurses who are really inspiring to me. The first is Mary Eliza Mahoney, who lived from 1845 to 1926. And she's inspiring because she overcame a tremendous number of obstacles to become a nurse and a leader. Most particularly, she overcame racism to first become a licensed nurse, to practice as a nurse and to gain respect, but also in leadership and in nursing organizations. She was among the first members in the American Nurses Association, but she split from that organization because they really weren't welcoming of nurses of color. And she and two other women, two other Black nurses, formed the National Association of Colored Graduate Nurses, which was a completely inclusive organization. The other nurse who's inspiring to me is Lillian Wald. She lived from 1819 to 1892, and she's inspiring to me for a couple of reasons. One, she was a true public health nurse. She was really in the community, doing her best to promote health, but also prevent disease. She was particularly involved in working with immigrant families in New York City, in tenement houses. She was so involved with that work. In fact, she moved into a room in one of the tenement buildings so she could be close to her patients. I have a variety of experiences in community health and in public health nursing. I think what stands out to me the most from my own experience is work that I did in urban areas, in particular in and around Miami, Florida. In the early 2000s, I worked with women who had HIV and AIDS, and who were challenged with a number of other conditions, in particular sexually transmitted infections that complicated their health further. At that time, there were treatments, pretty good treatments for HIV, but they were difficult. They had a lot of side effects, and if you didn't take them very well, regularly, on time, etc., resistance could develop. And a number of the women were challenged because they were financially dependent on partners who unfortunately were also HIV positive and had other partners and were not taking precautions. So their partners were bringing back additional sexually transmitted infections, which made their health challenges all the greater. And a lot of these women just did not have the resources or the ability to just leave their partners. The other piece that was really challenging for this community with HIV is that there was so much stigma around having that disease. So many of the women lived with a lot of emotional distress over that. But also the women who had children, whether the children had HIV or not, worried about the future and the well-being of their children in light of their own health, the mother's health declining. I would say that a public health term or a public health concept that really resonated with me through that experience I had working with women with HIV is harm reduction. Though I really wanted my patients to do everything possible to reduce their risk of getting reinfected with HIV, different strain of HIV, and getting infected with other sexually transmitted infections, which would be completely abstaining from sexual contact with their partners or leaving their partners. I really had to embrace and try to convey to these women the idea of harm reduction. So any measure that they could take to at least reduce some of the risk, maybe getting their partners to sometimes use condoms or to use condoms with other partners, making sure that both were getting good health care, we're keeping their viral load of their HIV to as close to non-detectable levels as possible, and so on. So harm reduction is the public health term that really resonates there. So now that I've introduced myself and a little bit about my background, I would like you all to do the same, following the prompts that we provide in the YouTube Introductions forum, which you'll find in the Week 1 block of the course. All right, looking forward to getting to know you and having a very productive semester of learning. Take care. Thank you.